It is now time for our panel roundtable discussion. It is titled Career Ladder in Nursing Informatics from Novice to Expert. And again, as mentioned, for more information on all our panelists, please connect with them on LinkedIn. So first, we welcome Julie Luengas. Julie is a nurse executive IT with over 20 years informatics experience. She is the Chief Nursing Informatics Officer at Stony Brook Medicine, where she collaborates with nursing to set their IT strategy. Julie also served as VP of Informatics and a CNIO at St. Thomas Ascension Health, where she was responsible for the delivery of informatics solution across the organization. Next, we welcome Jen Zuber-Bozek. Jen is a senior healthcare executive with Cerner Corporation. In this role, she works with clients to optimize their electronic health record by making best practice recommendation and advising on complex clinical workflows. She has 20 years of nursing experience spanning the emergency room, perioperative, and long-term care. We also welcome Paul Hoyle. Hoyle was recently named Senior Vice President and Chief Nurse Executive at the Hospital for Special Surgery in New York City. He serves as president and co-founder of Inspirion, a nurse-led technology company. He is a recipient of over 20 international awards, including Crane's 40 Under 40, Artificial Intelligence Person of the Year by the Global Achievement AI Awards, and Top 25 Innovator by Modern Healthcare. And we also welcome our fourth panelist, Sarah Collins Rossetti. Dr. Rossetti is an assistant professor of biomedical informatics and nursing at Columbia University. Her research is focused on the tools to mine and extract value from EHR data and leveraging user-centered design for patient-centered technology. Dr. Rossetti is an experienced critical care nurse. She was also selected as a 2019 recipient of the Presidential Early Career Award for Scientists and Engineers. We are honored to have you all today. So our first question for our panelists, and I am going to send it over to you, Jen. What was your path or progression in your career to get to your current role?
Good morning, everyone. My path and progression, actually, I started out as a staff nurse working in the perioperative space. I had a bit of a non-traditional path, I would say, in informatics, in that I then moved into a staff educator role, specifically for perioperative, but found that I was kind of gravitating towards more technical projects at that time. I was doing a staff education role more specifically related to it, and then really just was kind of looking for something a little bit different, and had my resume out on the internet and was actually contacted by Cerner to take an additional look. So it was a bit of a non-traditional path. When I joined Cerner initially, I worked in an analyst role, so really learning solutions, digging into the build of the solutions. Eventually that evolved into more of a workflow focused type of role. I then took a role with an organization where I was then focused more on a management of information systems role, and then bridging into other apps outside of clinicals, including business, revenue cycle. And as a result, I then went and obtained my MBA to kind of help support in those efforts. And then I moved into a kind of a consulting strategist type of role, more on a national basis with Cerner. And now as a healthcare executive, I focus on some of our more strategic clients, our reference partners, kind of working with them as early adopters of some of our solutions, working as testing partners, and really helping them leverage our EMR solutions to the best of their abilities. So a bit of a non-traditional path. I kind of got in a bit early. So I don't have a degree specifically in informatics. I kind of grew into the role per se. But I think getting in there and trying to leverage any opportunity possible, whether it be as a subject matter expert or a super user or a trainer, I think is a great way to kind of get your foot in the door.
Okay, well, thank you so much. Julie, same question.
Hi, good morning, everyone. So mine started, this was 25 years ago, and between my junior and senior year of nursing school, the organization I was at had electronic documentation in the ICUs with integration of the monitors. And I was just really excited that I could see and read other people's documentation, be able to pull the values in. And my nursing school had offered their first informatics course at the start of my senior year, and I signed up for it. And just really, I had felt the bug at that time and said, well, I have to be more involved with this. The organization that I started working at started their electronic health journey about 6 months later. So I started, being a content expert, which was kind of interesting since I was out of school for 6 months. Showed up with all my assessment books for design because, to make sure that we're pulling it from the latest evidence. And then from there, I did, kind of the standard things where I was train the trainer. I trained the classes. I did go live support. And then I slowly transitioned into the information technology department, and I led design sessions, did current state assessments, then went on to help the organization set the strategy for where they wanted to go. And then that led to a career in consulting for 5 years. And that was really exciting. And as you're there as being the consultant and providing expert knowledge, you truly are learning from every client site that you go to, because every site that you encounter, you find that they're doing something different and they have best practices, and it's really exciting. And then that career led into my role at St. Thomas with being a Chief Nursing Informatics Officer.
Thank you so much. Sarah, your journey?
Great, thank you so much. So I started as an ICU nurse. In my first job, I was in a new graduate critical care program at Mass General Hospital. I was in the CCU there. And for those that are familiar with Mass General, I mean, it's a fabulous hospital. It was actually where a lot of informatics was founded, and so the systems that I was working with at the time, they were hybrid systems, so some on paper, some electronic. The electronic systems there, it was really the CPOE and a few other electronic systems. They were very well designed. And so I experienced that. And then I experienced that hybrid system too, and so where you say, oh, okay, this could be better, and kind of comparing some of that. I then went on to work as a travel nurse, and I worked with some very, very different systems. And it was quite eye-opening. I was working at some community hospitals as well. And so the difference then, of course, from academic, medical center to community hospital, you're experiencing different systems from many different levels and perspectives. And, I really started to question, or observe, I should say, that the systems I was working with, and I mean the actual documentation system as well as the processes around our care, influenced how I felt, how good of a nurse I could be at times, how well I could care for my patients in the sense of the time that I had, the resources that I had, and what I wanted to be able to do. And so observing that really struck me. And I had over a couple of years, found informatics, or discovered that it existed, I should say, and applied to some programs. And I knew that I wanted to go into research, I think, because of these types of questions that I was asking early in my career when I experienced these different documentation systems. And in some cases thinking, where are these requirements coming for what we're being asked to document in some extreme ways, in other ways, when there are no requirements, thinking, okay, something's missing here, and questioning, where's the evidence for it? And so while I sometimes couldn't yet articulate that I wanted to, I didn't always know I wanted to go get my PhD. I thought maybe it was more of a master's in healthcare management at some points earlier in my career. Then I applied to master's nursing informatics programs. And I applied to Columbia's program. They had just gotten rid of the master's nursing informatics program. So this is one of those serendipitous things that happened in my career that just opened doors for me amazingly, because they noticed in my application, I was writing about those observations I had been making and questioning, what was going on in my practice and how these systems influence things. And they forwarded my application to the PhD program. And, from there, I was just incredibly lucky. I had been planning to go and get my master's while working, perhaps at night in the ICU. In the PhD program, I was funded on a training grant. It was full time. I could then work per diem as an ICU nurse, but it was a very different, schedule where I was able to really focus on graduate school and then meet some incredible mentors who then showed the path for academic career to me in a more clear way that I could really see how it was feasible. And so, I couldn't have been more fortunate to apply to a program that didn't exist, right? And and be given that opportunity. But I really think it was being open to kind of what was going on clinically early in my career that kind of led to informatics.
Yes, so thank you so much. And Paul, please share your path.
Sure, thanks. So I was a derivatives trader at Goldman Sachs. I started my career on Wall Street, and actually my role there was to bridge the gap between we built all our platforms and trading platforms in-house, and so there was a trading desk and there was an IT team, and I sort of sat in the middle, which was foreshadowing of the role of an informaticist in healthcare, but I didn't know that at the time. So I did that role. I actually suffered a stroke and had to recover and learn how to walk and talk again. And as part of the healing process, wanted to go back to school and become a nurse. Went to a lot of school in a short period of time. I got a bachelor's, master's, and a doctorate from Columbia in nursing. And then at the same time, I went to Northeastern and obtained an MBA and a Master's of Science in Finance, and got those degrees in 4 years, and then came out looking for work and struggled a little bit because I had got all those degrees, and then people were like, well, what do you want to do with them all? And I just wanted to not be sick and not have a stroke and be able to contribute to society. And the leads at finance of New York Presbyterian Hospital called me and asked me if I would come work on some of their corporate bonds. And I said, if I wanted to do, bonds, I'd go back to Wall Street. They said, well, how about analytics? And I said, I didn't know anything about analytics. At least I didn't think I did. I didn't have a degree in it. I had 6 degrees, but none of them were in informatics or analytics. And they said, no, we think it's kind of the same thing that you used to do at Goldman. Kind of, there's doctors and nurses and clinical people. There's these IT people that pull data out of a SQL database, and we think you'd be really good at, translating and being able to get results like you did at Goldman. I said, all right. So I did that for two or 3 years, and learned analytics, learned how to, SQL databases, Tableau dashboards, like all of the data that was being provided back to the operational clinical operations teams to improve quality and financial performance. And now, just a quick aside, analytics and informatics, we kind of lump all these things together, but they're perhaps potentially different skill sets that we could break out further, which we can talk about a little later. But anyway, worked in analytics, then wanted to get actually closer to the clinical operations. And then HSS asked me to manage the informatics team, their nursing informatics team, and I did that. And then people kept leaving, or I was either good, really good, or people kept leaving, or a little bit of both. And I kept having increasing levels of responsibility, ultimately becoming the Chief Nursing Informatics Officer, responsible for informatics, but also employee health and infection prevention during COVID. And then 5 days ago, became the Chief Nurse Executive of the enterprise. So thank you. So it's been quite a week for me. It was a great first week. And along the way, partnered with a group of nurses and technologists sort of in my spare time at night and on the weekends. And just for the last 5 years, created a company, Inspiron, that's doing pretty well. We invented a hybrid sensing device that goes on the wall behind the patient bed, using computer vision and Bluetooth to analyze the physical and digital environment of the space. And so we're live in about 10 or 11 hospitals and nursing homes around the country. And that's been just a great journey of, startup entrepreneur informatics, really sort of going outside of healthcare systems to partner with industry to create a product and deliver it to market. So thank you for having me, and looking forward to the discussion.
Thank you so much. So as you can see, there are multiple different ways to get to the end goal in informatics. And that's the whole point of this, symposium, just kind of exposing those different areas. So the next question I will give to all the panelists, but I'll start with Sarah first. What was the best career advice you ever received?
This is a great question. Yeah, and certainly needed to think about it a bit. But I think, in thinking over it, it all kind of boiled down to this common theme of, yes, you are ready. So when opportunities present themselves, and often when they present themselves, you feel like, whoa, that's a big role, or, that's a big, committee or task or, effort or something. But yes, you're ready. You still want to grow in your experiences and get deeper expertise as you go through your career. But if a leadership opportunity presents itself, more than likely, it's a great idea to say yes. And with that approach, there were a series of years after I had completed my postdoctoral training, when I was in my first position post my training. I was up in Boston. I was at Brigham and Women's Hospital. It's now the Mass General Brigham system. And I had an appointment at Harvard Medical School. And I said yes to pretty much every opportunity that came by. And what I now realize is my visibility from a national level in informatics with informatics, professional societies really grew. And then it just snowballs in terms of further opportunities that you're given. And as an informatics researcher, being able to kind of have those collaborations grow and have these opportunities, that those types of collaborations really enhance your ability to do research, because the research that I seek funding for really needs to be multi-site research. I want it to have impact and be in the applied space. And so working, taking on kind of operational or professional society leadership opportunities really has been amazing.
Okay, thank you. Paul, same question?
Yeah, I think, so like I said, 5 days ago, took the role. So that was great advice, Sarah. I needed that today. Thank you very much. And I think I was the same sentiment that she expressed, actually one of the senior leaders of the organization. When I asked him, what advice for the role, he told me, just keep being you. And I said, all right. And I think to, sort of double down on what Sarah said, I think everyone has strengths and talents that are unique to them, that have allowed them to be wherever they are in their career and their life. And those same skills and talents that are unique, what makes them capable, what makes them unique and deserving and worthy. Each of us has their own unique things, the unique answer to that question. And it's made each of us be where we are right now. So there's no reason why not to use those same things to be more successful in the future. And I think when people take a new role or there's a new opportunity, people are like, oh, well, I don't have this like that other person that was in that role before, or I look around and all these other people have that. Well, they're not you, and the opportunity. And so the role is a role. You are still you. And I think thinking of life and a career that way, you just then move through roles, still being you and your great self. So I think, thanks, Sarah, for reminding me of that, and hopefully I helped help everyone else remember that too. But that's probably the best advice I got, and I just got it 5 days ago from our senior leader of our organization, and also now from Sarah. So when you hear things multiple times, it makes you pay attention. So that's the advice.
Okay, thank you. Julie, what about you?
Well, I'm going to agree with something that Dr. Quinlan, Dr. Gosselin, Dr. Coyne, and Dr. Rosetta all had said as well. It's that ongoing growth and taking the advice. And with each role, there's different advice. So I can't say that there's one specific piece of advice that I had. So in different parts of my career, one of them was when I was a consultant was to read Edgar Schein. He is an expert on process consultation, culture change, and understanding the impact of what you're doing and how it's changing people's lives. As it was discussed, it's not the fear of staying where we are, staying with change. It's that in between and understanding the impact and being mindful of that when you're working with others. As I continued in my career and then moved on into a chief role, I had, for example, a person was really upset, I had sent them an email, I had sent them a phone call, and my boss said to me, Julie, that worked well in your previous role, but in your new role, you need to go to their office and sit down with them in person and have a conversation with them. Email's not going to work, phone call's not going to work, you need to go to them. And it's these different steps in the process that lead you and that continued growth and understanding that as your roles change, yes, you still bring yourself, but there's some changes that you have to make as well. Another piece is being objective, hearing all sides, not making assumptions, and, and listening and trying to always be, positive. As they talked about, your team looks at you as you're leading. How you react to things is how they react to things. And, it is also, hard to be very humble, but we have to be humble and understand what they said. When you make a mistake, own it, address it. We're human. We're not perfect. We try to. And I think some of the things that Dr. Quinlan said, I think it's almost good to have an annual reassessment. And how do I go back to those, appropriate best practice processes? And it's okay to say, well, I need to work on my emotional IQ a little bit more, and that's normal. And I think it's, being willing to accept that ongoing change is needed.
Thank you so much. And Jen, what about you?
Well, not to steal from everybody else, but I think there's some very good nuggets, I think, from everybody here. I think really it's, I was told early on that there really is no perfect path. So, to look at every opportunity, look every challenge as an opportunity, right? So, you may have had this path in mind for yourself, but the opportunities present themselves. You might think, oh gosh, I don't really want to get involved with this, or it's a very stressful problem. But by taking a step back and looking at it and saying, well, what can I contribute? What can I give to this effort? You may find, like I have over the years, that it turned into a career consulting or other opportunities. So I've always found that has.
Okay, thank you. We are getting some good questions that I'm trying to gather in the chat, so bear with me. But Julie, I do have a question for you, and then anyone else can answer. What is the importance of being actively involved in a professional organization like HIMSS or, on a national or local level, or even some nursing organizations?
That's a great question. So it has multiple benefits to it. One, you're contributing to knowledge within your professional association's career and with others. In addition, you're meeting others that are in your industry as well. It's always great to pick up the phone and say, hey, how are you guys doing this? And you're meeting all these people from across the country. And it's learning. You're learning as well. And it's making those connections. And, one of the things that they group talked about is as you meet others in your industry, you hear about their career path, but also as you work with them in these professional organizations, they'll might let you know of opportunities that are coming up. And I think one of the things that Dr. Quinlan said was about the relationships that you're making, and always ensure that you're building on those relationships, making them positive, and being involved with those professional organizations gives you other opportunities to meet others in your industry.
Thank you. I don't know if anyone else would like to add. If not, I'll go on to the next question.
Yeah, I'd like to add something else. Julie, absolutely agree. Those, relationships are so key. And then when we think of ourselves as informatics professionals, in the informatics discipline, knowledge dissemination is really a core principle in what we do too. And so, if we have successes in our own institution and we learn how to, redesign something, how to do something in a better way, I think that as an informatics professional, I then think we have an obligation to share that knowledge. There's work that we're doing right now to, a large national effort called 25 by 5 effort to reduce documentation burden. And what we've found is that there are these pockets of really great work that nursing has done throughout the country to reduce their documentation burden. But the spread of that knowledge, and what has operationally been done at these health systems just hasn't really happened yet. And so, we're all in this together, right? And we need to start sharing. It's not just researchers that need to publish and share information. We need to hear, from the health system communities and our clinician leaders, what is it that works? Because we need to apply that elsewhere too, and professional societies to bring that all the way. What I mean is professional societies are an enabling organization that can help us do that.
Absolutely. I'm a postponer for that. I mean, I belong to like 7 or 8 different organizations and sit on the board of many. And they're like, why? I said, because it's just a matter of sharing content from one organization to the other that just, it lights my Okay, I do have a question. I think this one is going to be for Paul. I'm curious how your informatics team is involved in analytics, including data governance, stewardess, and surfacing data in actionable for nursing and operations. And they also congratulated you on your new role.
Thank you. Yep. So yeah, like I said at the beginning a little bit, the skill of informatics has traditionally been very focused on the electronic health record, and that is where the majority of the data sits. But there's a lot of other data sets that are being generated, and so IT, whatever EHR the organization has, sort of aligns to that. The IT analysts and the IT teams learn the modules of that system. There's operational informatics clinical informatics teams that learn it as well, and then partner closely with the clinical operations teams to ensure all of the documentation is, optimal in every way that it needs to be optimal. But the analytic component of where all that data goes after it's made in the EHR, and then how it's combined with other data from financial systems, HR systems, other devices that enter the space, is really where I think there's great opportunity to expand both how we view informatics and how we view analytics and how we view clinical operations. I think the three of those things together are sort of where there's great impact and opportunity for the future. So, at HSS, we've established a council and a committee that incorporates frontline nurses, informatics, traditional informatics teams, as well as the analytic team, who, the database administrators, those kind of individuals, to really determine how we create a data infrastructure that supports having all the data in one spot, whether that's SQL, NoSQL, data lake. There's a lot of different ways you can make a database, but that the organization knows sort of the base layer of how data is arranged in the organization, and then can build on top of that to deliver. Because if someone like me in my new position says, I want to see this data point, in order to have it really fully, very rarely is it just coming from the electronic health record anymore. We have to look at all of the data sources in the hospital, and to do that requires everyone to work together in a more expansive way. So, there's committees. It's just really looking at the organization. Every organization is structured differently. Every organization has a different way that all of these teams are aligned. But just to be truly interdepartmental and really go seek, I think, the analytic team, whoever's managing that, to support the initiative has great impact. So we're doing that now at HSS, and That's probably how, but it's a challenge. It's kind of new. We didn't have that much. I mean, 10, 15, 20 years ago, the data that mattered was in the EHR, but now we're putting all these advanced sensors in the room. We're putting new, medical devices are all generating their own data, and sometimes it integrates with the EHR, and sometimes it doesn't. So there's a lot of data points to capture that we could capture, and whether all that flows to the EHR and then goes to a database that we can get the data out of, or whether that flows to different places and then ends up in the EHR. You just need to look at it, but that's it. It needs to be included, and I find often that analytics and that entire team or that support function of the hospital is just not involved in the discussion at the time. Perhaps the IT team or the informatics team goes and finds them, but it would be much more helpful if we all were in the room at the same time.
So true. Anyone else want to add? If not, I'll go on to the next question. Okay, so this one I'm going to start with Jen. And there's a couple of questions that are asking, how can you create opportunities for yourself if initially there aren't any opportunities or ways to break into new roles?
Sure. So I think I kind of alluded to this a little bit earlier. I think it's really about seeing where you can add value to perhaps things that are already going on in your organization. So if you currently work, say, in a acute care hospital and there's a project that's being proposed, it doesn't even have to be informatics related, to be honest. Volunteering and getting your name out there to be a member of a team. So if it is informatics focused, even better. And that could be being a subject matter expert on a topic and contributing to workflow design. It could be a super user or being a tester. We always need people that can let us know what's working and what's not before we flip the switch and go live. I think being a part of those key roles, trainers, another one, getting your foot in the door that way and getting your name out there to those. Sometimes you might end up actually creating the role. We found that over the years too, that there are roles that didn't exist before until people realized that we needed them.
This last question, and then I'll look in the chat to see if there's anything else. But, and this will go to everyone. What part of the nursing informatics role do you find most rewarding? So I'll start with Jen.
For me, I think it's being able to support those that I know have such a critical, oftentimes challenging role of taking care of patients. So, whether that might be, reducing their time spent in the chart, or reducing the clicks per patient, or brainstorming a new way to solve a problem. Those, what can seem like little things on a report, can make a huge difference in their lives and the lives of their patients. So those are really the things at the end of the day that kind of keep me going on those tough days. It's just kind of reflecting on those successes.
Thank you. Sarah, what about you?
Yeah, it's interesting. So my department, an academic department, our kind of motto is discovery and impact. So as a researcher, I want to do both of those. As an informatics researcher, my work has to have knowledge discovery to it. What do we not know? What is new? What is important? But it's that what is important piece and making sure it can have impact. A lot of the work I do, much of it does extend to patient outcomes, but some of it, some of it is focused on the nurse, right? Right now, I'm heavily focused on a large effort to reduce documentation burden. That, I think, can be hugely impactful to nursing and all of our clinicians. The focus is broadly for all health professionals. And, hearing the talks earlier today around, resilience and wellness, and I mean, we have to do something, right? There are a lot of problems right now for what our clinicians are dealing with. And as a nurse informatician, I can't, like my research and the, operational and professional work I do is not focused on solving all of the problem of burnout, but I can focus on documentation burden and, EHR
the burdens that the EHR currently bring, and to be really laser focused on that, which is actually a big problem, right? So I say laser focused on it, but there's a lot of area within there. You know, just taking pieces and having a long-term plan around it. To me, it's motivating because, you know, I remember what it was like to be at the bedside and recognizing what, you know, our workforce has gone through the past couple of years. It's just so incredibly important. And so that's where I see that nursing informatics is just, you know, has an obligation and an opportunity to play this amazing role in what we can do for nursing.
Okay, thank you. Paul, what about you?
I think it's a role that is, and we talked a little bit about it, by nature, it is extremely expansive and allows one's mind to be able to see healthcare both in a very, in the way that impacts the front line, but also in a broader way as well. So, you know, it's a role that lends itself to be able to take what you've learned, you know, from the bedside if you're a nurse or wherever you started, that's very one-to-one and perhaps a narrow focus, but a very specialized focus, and then take that skill and apply it more broadly. And I don't know, there's not that many roles that do that. I think healthcare has technical, there's the three major forces that I see are there are financial forces, there are clinical forces, and there are technology forces. And those are three different skill sets. And the role of informatics has a role to bring all those together, and they have to be brought together in order for us to make healthcare better, truly. And the role of the informaticist is able to bring those together and deliver great care for patients. So I think it's intellectually exciting to bring those together, but it's also fulfilling to know that you're bringing together people and skill sets in a way that adds optimal value to patient care on a larger scale.
Thank you. And finally, Julie, what makes this so rewarding for you?
To know that we've improved the day-to-day experience that our clinicians have when they're interacting with the digital tools that help support them to provide patient care. And when we're changing the lives of our patients, you know, when I think about like sepsis alerts and different things that we've implemented across the organization, and that helps our clinicians, you know, that they have such a, you know, just thinking with even COVID, the volume of patients, the acuity level. So when we see that they're happy with something we've delivered, we know that they feel it's add value. It adds values to the care that they're providing to the patient and improves the patient outcomes. And that's when I find it really rewarding.
Thank you. I see that we're almost out of time. So I just would like to thank our distinguished panelists for sharing their journeys and their wisdoms with us this morning. I hope everyone, I know I did, gain some insight with our informatic leaders, and will use this to strengthen your careers. Olga, I turn this back over to you. Thank you all.